The risks of ambulatory phlebectomy include bruising, bleeding, rare allergy to local anesthesia, tenderness along the removed vein, rarely infection, rare swelling, and a temporary numbness. Risks of RF closure include recurrence in several months to years, which is similar to surgery. Closure is 95% successful, however, other risks include bruising, a heat sensation during the procedure, and small areas of numbness lasting 6 months or less. Risks of laser or intense pulse light include no improvement, redness or swelling, skin pigment changes lasting for months, blistering of the skin, burning pain for several hours, and rare white scars. Here is an example of redness or swelling immediately after light-based treatment. The injection technique, or sclerotherapy, also has a number of risks. These include skin darkening in the outline of the treated vein. A prolonged blush, or what is called matting, may also occur. Bruising, particularly for a few days after. A knotty feeling, particularly in larger veins. An allergic reaction to the sclerosing solution, and extremely rarely skin breakdown or ulceration. Rarely superficial venitis or phlebitis, different than deep venous thrombosis, can develop. Skin darkening, called hyperpigmentation, refers to brown spots that look like bruises caused by the iron in red blood cells left behind after treatment. Occurring in approximately 1 out of 10 patients, this brown staining may also follow the path of the treated vein. Brown spots may take weeks or even months to disappear. They are minimized by wearing support hose after the treatment. In this severe case, the brown outline of the veins is visible after treatment. The vein is completely treated and will disappear on its own in another 2 months. Another common side effect is the blush or matting. A red blush comes from enlargement of tiny capillaries irritated during the injection process. This usually takes weeks to months to spontaneously clear. Occasionally, further treatment is necessary to improve the blush. Here is an example of a blush that disappeared on its own without any further treatment. Accumulations of blood in larger treated veins may lead to a feeling of knots. This lumpy feeling is temporary and caused by trapped blood, like a bruise within the vein. Sometimes a visit to the office to remove this bruise-like accumulation will instantly reduce discomfort. Larger treated veins have greater space within them to accumulate blood. As with the other possible side effects, use of support hose minimizes these possibilities. This is a knotty vein which turned brown following treatment. This disappeared spontaneously in 2 months. Good methods of pressure or compression over the treated veins reduces the incidence of this side effect. A rare side effect of the injection method is skin breakdown or ulceration. Rarely blistering, ulceration, infection, and scarring may develop at the injection site. This occurs when a person is extremely sensitive to the tiny amount of solution that may leak out into the skin during the injection process. It occurs in far less than 1% of patients. This is an example of a small ulceration which healed without scarring. Superficial phlebitis, not a dangerous condition, may occur from the bruise that accumulates within the vein after treatment. It is usually limited to the site of treatment and rarely progresses to form a real clot. The incidence is extremely low. This condition is very different from deep thrombophlebitis. This shows the rare spot where redness and tenderness occurs following injection of a large vein. This disappeared quickly. Does treatment limit your activity in any way? Most patients may resume normal activity immediately. In fact, walking is important right after treatment. Support hose must typically be worn for 1 to 2 weeks. Heavy weightlifting with the legs should be avoided for several days after treatment. Hot baths and showers should also be minimized for several days. A sound treatment plan is based on quality physical examination and non-invasive testing. When varicose veins start in the groin, RF closure may be necessary first. Injections, laser light, and/or mini puncture vein removal techniques may be required alone or in combination. It is important to understand that larger varicose veins may be treated entirely differently than smaller spider veins. Larger varicose veins, like the saphenous vein, may need closure with radiofrequency or stripping. Side branches of larger veins may need the tiny puncture removal. Medium-sized veins can be treated by puncture removal or sclerotherapy. Smaller veins need sclerotherapy or laser. Many patients ask this question. Varicose veins cannot be used for bypass surgery. Removal of abnormal veins actually redirects flow to the normal veins of the calf and thigh muscles. In fact, venous circulation improves with better elimination of waste products from the legs after elimination of varicose and spider veins. Modern vein treatments, when performed by highly trained professionals, are safe and very effective. Be prepared that things may look worse before they look better. Remember, side effects can be minimized by wearing support hose. Non-invasive testing is often necessary for larger veins. For vein treatments, sometimes results come slowly. Be patient. Most patients will need a series of 2 to 6 treatments for spider veins. Phlebectomy and RF closure usually require only one treatment.
The excellent results seen in thousands of patients are illustrated by these before and after pictures.
If you have any other questions, please don't hesitate to ask our friendly staff. We welcome you to our practice.